test today. Could you verify your name and date of birth? Checking your wristband here, and that's what I have here on the screen. I see you have an allergy to penicillin. Do you have any other allergies that I should be aware of? Okay, now I'm just going to take a look at your provider order. I see your provider has ordered a 12-lead EKG. So with a 12-lead EKG, I'm going to place some electrodes on your chest and hook you up to the monitor and get a visible baseline of your heart. It should only take about 10 minutes and it should be painless. So I'm just going to raise your bed to a working level, and I'm also going to lay you back supine. Okay, now I'm going to provide privacy. Okay, once I provide privacy, I am going to expose your chest and your lower extremities if that's okay. Going to expose your upper and lower extremities. Okay, now I have exposed your upper and lower extremities. I'm going to just take a look here at your chest area. I don't see any visible hair, but if you did have hair, I will clean it with alcohol and shave it and make sure I dry it with a cloth. Okay, so now I'm going to do hand hygiene again, and I'm going to grab my electrodes. So with these electrodes, I'm going to place them for the legs. I'm going to place them up towards the heart, making sure not to place it on any bony prominences. Okay, making sure they're facing up towards the heart with the arm leads. Here. Okay, take a look at this lead right here. Okay, so now I have my extremity leads placed. I'm going to start with the chest. So I'm just going to let this bed roll down here so I can have a better angle. Okay, so my first lead, I'm going to find my suprasternum notch and go down to my angle of Louis. I know my angle of Louis is my second rib, so I'm going to go over to my right sternum border. Once I'm at my right sternum border, I'm going to go down to my fourth intercostal space. So second rib, second intercostal space, third rib, third intercostal space, fourth rib, fourth intercostal space. And here's where I will place lead one. Okay, now I have placed lead one. I'm going to do the same thing for lead two. I'm going to find my suprasternum notch, go down to my ankle of Louis. Now I know I'm on my second rib. We're going to go to my left sternum border. Okay, second intercostal space, third rib, third intercostal space, fourth rib, fourth intercostal space. Here is where I will place lead two. Making sure they're about an inch apart. Now I have those two leads placed. I'm going to skip lead 3 and go on to lead 4. So lead 4 will go fifth intercostal space, mid-clavicular line. So I know here this is my fourth intercostal space. This will be my fifth rib. This will be my fifth intercostal space. I do have breast tissue here, so I would displace this breast tissue and make sure I place this lead right here, mid-clavicular, fifth intercostal space, kind of right below that nipple line. My third lead will go in between lead 2 and lead 4, so I will place lead 3 about right here. Okay, now that I have lead 3 placed, I'm going to go on to lead 5. Lead 5 will also be 5th intercostal space. 5th intercostal space. Left anterior axillary line. Sorry, I had a brain freeze. So making sure I stand on this 5th intercostal space, I'm going to displace this breast tissue. I'm going to kind of place it here in the crease. Okay, kind of lined up like axillary. Okay. Once I have that 5th lead placed, I'm going to place lead 6. Lead 6 will go 5th intercostal space, left mid axillary line. So it's gonna go kind of right here under the arm, mid-axillary. Left mid-axillary. Yeah. So now I'm gonna connect my leads. I'm just gonna go over here to my EKG machine. And I'm going to connect my leads. It's a little tangled, which is fine. So here is right arm before. Right leg. V2. Left leg. This is V5. Are you doing okay, sir? Ma'am? I'm sorry. Left arm. This is V6. V3. And V1. So now I'm making sure that all my leads are connected. Could you uncross your feet for me? Okay, so I'm gonna record your EKG. I'm gonna ask you to be very still and not talk while I record your EKG. So I'm gonna turn on my machine. I'm gonna wait for it to load up. Now I'm gonna hit record on my EKG machine. Okay. I'm waiting until all the artifacts go away. Once I see no artifact, I do see a visual baseline. I don't see any signs of a MI. If I did see any signs of an MI, I would notify the provider immediately. So I see a visual baseline, no artifact, no signs of acute MI. That's perfect. I'm gonna turn off my machine. Okay, are you doing okay? So now I'm gonna disconnect my leads. Now I have my leads disconnected. I am going to take off. I'm going to be sure not to be so rough because some patients can have a bit of skin breakdown or their skin can be fragile and it can easily break. Okay, now I'm just going to cover up my patient. I'm going to raise the head of the bed, and I'm also going to lower the bed. I would make sure my patient's call light is in reach, and I would pull that rail back up. I would go into my EMR and document my EKG and just make sure that it is in the computer so the provider can see. I'm going to do hand hygiene again. Is there anything else I can do for you? Okay, thank you.